Monitoring respiration represents the most undervalued and important parameter in the clinical setting, and it is usually the first vital sign to be altered in the deteriorating patient. In this first module, we will learn how to assess the visual, auditory, and vital sign cues of respiratory distress in our cleft repair patient. Respiratory rate is a fundamental measure that can inform the nurse on a decline in the patient's post-operational status. In monitoring respiration, there are important visual signs that should be noted. Patients who are having trouble breathing often display behavior changes that allow them to consume more oxygen in times of stress. It is important for the nurse to assess the patient for these visual signs by looking carefully at each encounter. The patient may appear agitated or tired, and breathing may require more work. This can include nasal flaring, a tracheal tug, or the use of accessory muscles of respiration in the neck and chest that would otherwise not be needed in a normal patient at rest. This is demonstrated with retractions of the subcostal or intercostal regions or a substernal recession. At late stages of respiratory distress, the patient's color around nail beds or eyes may visibly show symptoms related to lack of oxygen, such as in cyanosis. It is important to note that cyanosis is a late sign of respiratory distress and must be handled quickly.